Hi there, I'm Clarice and you're on the Live Ready channel. September is National Preparedness Month and I'm about to unpack my medical kits to share with you how I've delivered a baby, done CPR on patients and successfully treated some serious injuries with what's in these kits. Manage some serious medical emergencies with just the kit that I keep in my car, and this particular one is in my get home bag. Now I'm going to share the contents of my medical kit with you. I am a healthcare professional, I am HPCSA registered. I don't currently practice as a physio anymore, even though I do spend a lot of time working in the operating theatres. But I'm not a doctor and I'm not going to give you any medical advice in this video. My medical kits are split over two. I've got a traumatic kit and I've got a medical kit. And the reason why I've done that is so that I know which one to grab really quickly and I can quickly decide what exactly I need and I know what is in which kit. And the first thing that greets me when I open this kit is a pair of gloves. So I've got some nitrile gloves and I have some latex gloves. Now remember that there are people who have latex allergies, so important to ask your patient or whoever you're trying to help whether they have an allergy for, first of all, elastoplast or plasters, latex, or iodine. If I have to deal with a big bleed, then I know I can start working left to right in my kit. I've got a tourniquet here. I've actually got two tourniquets. It's better to keep two. Now, this is a Windlass tourniquet. It's actually one of the better ones to use. I do have one of these just clip-on ones, but they're not particularly great. So I'd really suggest that if you really have to apply a tourniquet, add a mechanical component to your tourniquet, something that twists and tightens and then can stay hooked and stay put in the manner that you've tightened it. If you don't apply enough pressure, you're not actually stopping arterial blood flow. If you apply a tourniquet to a limb and it's there for an extended period of time, you risk ischemia, so only apply a tourniquet if you absolutely have to. The reason why we keep two tourniquets is if the first one isn't effective in stopping the blood flow, you're going to need to apply a second tourniquet. One thing that I have added in here that I don't see in a lot of medical kits is a covering of sorts, and it's something that we use in the operating theatres to cover the C-arm when we take x-rays. It's a C-arm cover and it actually comes packed sterile. This is not sterile anymore, it is open, but once I remove this covering from it, then I've still got a clean plastic packet. And the reason why I've added it to this kit is whenever I've had to treat some or the other injury, I've always needed a clean surface in which to unpack my kit, because what happens is you end up with blood on your gloves or on your hands, and then you want to access more things from your kit. So if you open up a nice clean space for yourself, whether it be some of the other plastic bag or a towel, what you can then do is remove the contents of your kit that you think you're going to need, place them on your covering, and then you can work from your covering without contaminating the rest of your kit. A family member recently was busy with the weed eater outside in the garden and had removed the cord that usually sits in the weed eater and replaced it with blades. Managed to make mincemeat out of his leg and there was a lot of blood, and so what you need is something to staunch the blood with. You can imagine how fast those blades move and how much cutting they do in a split second. So the second thing that I have really easy access to are some wound packing materials. And these are bandages and they've got a pad, a bandage pad or a wound pad on them. So once you open them up, there's a nice big pad on them and you can use that to apply pressure to a bleeding wound. Now I know a lot of people have access to and use things like Israeli bandages. An Israeli bandage just helps you to apply a bit more pressure to a big bleed. These smaller ones are nice for fingers. Something like a degloving injury, you will need something to cover that finger or to cover that hand. And then it is nice to have different sizes of bandages, especially because you need to get around the digit. These are just wound packing pads, so you can open these up and just pack until you've got some pressure on that wound for bleeding. The next thing that I've got in my kit is a triangular bandage, and it's something that we just use to splint an arm or to create a support for an arm or for a limb, but it can also be used to help staunch bleeding. The next thing that I've got in here is some plain old gauze, and that's really great for cleaning the area around a wound. I'm referring back to my previous example of the weed eater incident, where I also needed a pair of tweezers in order to delve out all of the dirt and the grime and the grass that was churned into that wound by the blades. Just some bandages, and this is a big upside dressing. The reason why I like it is because it's nice and soft, and it's relatively big dressing. So if you have a big wound, having a nice big dressing to cover it up with and keep all of the other bacteria out and protect the wound, I like to have a big dressing. Next out of my kit, I've got some hypodermic needles. I usually wouldn't use them unless I need to line something, so I keep those in there along with a syringe. Syringes are great for treating eye injuries or injuries that are quite deep, especially if you need to clean something out with a bit of clean water or distilled water. Now this has come out of the other side, and it's just some EAB or elastic adhesive bandage, and it's nice to help me secure bandages or dressings to an area. Because I'm a physio, I also know how to strap injuries, and this is just a smaller version of the EAB. I believe this is 25 millimeters. It can be super painful to have something in your eye, so I keep two different kinds of eye drops. The one hand, it's a lubricating eye gel, and the other one is just to clear eye drops. Then for cleaning wounds, I've kept this wound spray around. I really like it because it doesn't burn. It's an elastoplast wound spray. I have in the past gone and mixed this with an iodine solve, this one. Some people might know it as betadine, but iodine is a very good antiseptic. It's actually something that we use to scrub in theatre. Then this is some surgical spirits, just to clean things off, to clean scissors and things like that. Over here I've got some trauma shears. I can't say that they make particularly good scissors, but the guard on these scissors are great for if you need to cut clothing off to expose a wound. Now I've got in here a mouthpiece for CPR. One thing I can really suggest is that you go and complete a CPR course or a basic life support course, just so that you've got the basics down of CPR or emergency wound care. In here I also have some burn dressings, and depending on the kind of burn wound that you will be treating, you'll either choose a dry or a wet dressing. Burn injuries, we see so many, especially when I was practicing as a physio, we see so many kids and toddlers taking a hot pot of water from a stove or a hot pot of oil and pulling it down because they're curious, and they end up with severe burns on their chest and neck and sometimes on their face and hands. I have got a space blanket in here, and it just helps for patients who are in shock. I can help them just with thermoregulation, just put something around them and try and make them comfortable, especially if we're waiting for help to arrive. And I've got some wound closure strips. I would not recommend that anybody try to suture a wound in field. Other things in here include a electronic thermometer. This can actually go in the first aid kit as well. So that concludes my trauma kit, and the only thing that I could say that I would really add to this kit is something like umbilical cord clips. Now I've been in the situation where I've had to deliver a baby in the street, and obviously I didn't have umbilical cord clips with me because you don't think that that would happen to you, but it does sometimes happen. And I can improvise by using some bandages or something from here, but it is nice to have the clips around. The other thing that I certainly lacked in my kit was some sharp scissors, and this is why I said that I don't like the trauma shears very much. I've never found them to be an effective pair of scissors. Once again, when opening this kit, a pair of gloves greets me. So this kit is predominantly for treating medical conditions, ailments such as stomach aches, headaches, or follow-up wound care. But I've got some painkillers, paracetamol, and aspirin in here, and also just to treat fevers. Then I've got some antihistamine tablets in here, and I've got some sinus tablets in here, just to make it really clear and quick for myself to pick up. I've got in written, this is for nausea, this is for vomiting, this is for diarrhea on the back of each of these. And then I've got antihistamine salve. Now when I apply a salve or a gel or anything to a wound, I always go and put it on a gauze swab first. I never apply it directly to a person's skin. The reason why is because whatever is on that person's skin will contaminate my salve or my tube, which is not something that I want to do. Okay, what I've got here is an iodine tincture, and iodine is a wonderful antiseptic, so good to have this around. And something that I notice people usually actually don't have in their medical kits is some rehydration sachets or electrolyte replacements. So if someone has dysentery, They're severely dehydrated. I also need to replace their electrolytes along with the fluids that they've lost. And also replace them often to make sure that things don't expire in your medical kit. In this compartment here, I've got some more wound care materials, and basically once again a 25ml EAB. Once again, this is also mercurochrome. I've got duplicate of that. Then some alcohol swabs. These are great to clean skin, but I always try to remember that the alcohol will definitely make a wound burn, so I don't apply these directly to any open wounds. And then just something to once again clean wounds with, just an antiseptic ointment or an antiseptic liquid. Again, I've got a triangular bandage, because if I've used my first one to help to staunch a big bleed, I do have a secondary one, a backup. Everyday bandages that I keep in here, things for blisters or just an injury or a little cut to a finger or so. Micropore is great for wounds that are wet, so if you're trying to dress a wound in wet weather, can't get it dry because everything else is wet, then micropore does tend to stick quite well on wet areas. This is when I get to the finger bandage. And finger bandages are great because to try and wrap a whole lot of cotton or gauze or dressings around a finger can sometimes be a bit tricky. So to have a finger dressing that fits nicely on a finger and just protects that wound or that area while you're moving to the emergency room can be super helpful. It's starting to rain now again. Further to that, just some other wound dressings, smaller pads of gauze, larger pads of gauze. Well, that's it from me. I hope you've enjoyed this video. Go and stock up your medical kits and your bug out bag. Enjoy National Preparedness Month, and until the next time, live ready.